All right, thank you all. The clerk, can you take a roll call?
Alderman Hammond. Alderman Lewis.
Here.
Alderman Tom Grady.
Here.
Alderman Ted Grady.
Here.
Alderman Rapella.
Here.
Alderman Nichols.
Here.
Alderman Eisenach.
Here.
Alderman Sednick. All are present. Oh, and, I'm sorry, Mayor Marcus.
One day it'll get.
Don't let him in.
All right, thank you. At this time, this is our public comment on any matter listed on the agenda. Is there anyone from the comment who would like to speak? Ms. Taylor?
Sandra DeVille Taylor, 545 Broad Street. I have to say I'm at a disadvantage because without hearing the presentation that's going to be following, I'm kind of just winging my comments. I just want to clarify from a personal point of view, anytime an employer incentivizes employees not to take the insurance, I have a problem. That is something that just does not sit right with me. I think it's almost an obligation of an employer to provide benefits, and one of those being health insurance. So turn around and try to dump off your employees on another company. And a lot of companies have gotten very smart about this, where they actually are having you sign waivers proving that you cannot get insurance from somewhere else, so that it's caught on. So I kind of caution you on that. I just think it's something that, and honestly, the rates are going to increase regardless. It's basically based on the amount or the level of cost that they're incurring. And one thing I don't know exactly how the Menasha plan works, but if it's something that you may want to look into is self-funding, like the first $50,000 and having an insurance company cover the major medical, then the costs are, the premium cost would be generally quite substantially less. So I just enjoy the presentation, but I am not sold on this from just a personal point of view. Thank you.
So is that premium cost per month or is it per year or what?
She'll tell you.
Yeah.
All right, thank you. Any other public comment? Okay, we'll go on to item D. This is a motion to approve the minutes. Do we have a motion? Alderman Nichols.
Thank you, Chair. I'll move to approve the Personnel Committee meeting minutes from August 7th and August 14th, 2023.
Second.
We have a motion by Alderman Nichols and a second by Alderman Tom Grady. All those in favor? Aye. Any nays? Minutes are approved. With that, we'll go to our 3 discussion action items. I'll have the attorney introduce the first item on the agenda, which, as you see, is a slide presentation for the family health plan.
Thank you, Chair. Yes, the next item on the agenda, we have the Family Advantage Health Plan, a presentation by Sandy Motz of Cottingham and Butler, which is our insurance benefits broker. And just to highlight or recap the memorandum that was provided in your packets, health insurance is a major expense. And this year, we would have faced a 24% increase had we not, in 2022, negotiated a cap of a 12% increase. We don't have that benefit this year, that cap in place this year. So we also, though, don't know what our premium will be. That's probably mid-September. We should be expecting that decision. So we are trying to get ahead of the curve in terms of planning for insurance. And I think, last year we heard, well, we wish we would have had this information months ago. So we are trying to plan for an increase, and this is just one option that would cost nothing to the city to be able to provide, again, as an option to employees. So without further ado, Sandy Motz from Cottingham and Butler.
Thank you. Thank you for having me be here tonight.
So I'll start off a little bit before I jump into the presentation to address kind of a comment that this lady from the public made, because I think it's fair. You say, like, why would you want to incentivize? And I worked in public sector HR for a number of years, and my city council always had an issue with a sick leave incentive. Why did you reward people for not using their sick leave, right? You gave it to them to use when they were sick. You shouldn't have to incentivize them not to. But what's really happened for public sector, and the reason that this plan was designed is for years, private sector has been pushing dependents and children to your plans, because generally speaking, city and county government has offered a more generous health plan, lower premium amounts, and a more generous plan design, which sort of incentivized employees to jump on your plan. So public sector in general has a higher dependent ratio than you see in the private sector. So for years, private sector has been doing spousal carve-outs, telling the spouse, if you have other insurance, you can't be on our plan. And they've done some things to try and push some of those dependents your way. What the Family Advantage does is try to even that playing field to say, you're going to incentivize someone not to take your plan and instead go on a spouse's plan if available. Okay, so I'm going to just tell you how it works, and then I just want to answer any questions that you might have. So I want to kind of go over who's eligible, why would employees like this plan, what's in it for the city, and then we'll go through some frequently asked questions about how the plan works. Okay? All right, so what is the Family Advantage plan? It's an innovative health plan option that we offer that you really lay alongside your existing benefits. You don't have to change anything with your existing benefit plan. This is simply another option for employees. It will not be a solution for all employees, but for some employees, this can be a solution. It's better benefit for employees. It offers them a 100% coverage medical plan. It's lower cost for the city, typically 5 to 15% you will save on your net spend on your medical plan. And there's no gimmicks. You don't change anything else. And so the first reaction I often get is, well, that sounds too good to be true. And the first time I heard about this plan, I was a little bit cynical myself until I really learned how the plan operates. So how it works for an employee is you give them a payroll bonus, typically of $50 per member per month. It's a taxable payroll bonus for them to go on their spouse's plan. So a family of 4, you would offer them $200 a month to leave the city's plan and go on the spouse's plan. The city would then also open a health reimbursement account for that employee and their family who leaves your plan. And any expenses that would be incurred on the other plan, the spouse's plan, would be reimbursed by the city through that health reimbursement account for the employee. So in essence, that employee and their family member never has to worry when their son blows out their knee in a soccer game and they get an ambulance ride and have to have surgery and physical therapy. They never have to worry about a bill. That's going to be paid for by the city through the health reimbursement account. To optimize your eligibility criteria, it's only available to employees who are currently on the city's plan and have been on the plan for 12 months. So you probably have some employees that are already waiving because the spouse has a better benefit than what the city offers for medical. They would not be eligible for the Family Advantage Health Plan because they're already opting off. That, in effect, then reduces your sunk cost for the plan. So it's really pretty simple. The employees waive your plan, they go on the spouse's plan, so they drop the city's plan, we offer them the Family Advantage, you give them the payroll bonus, and you open a health reimbursement account for them. Okay? So why would an employee like this? So based on your current plan design today, employee pays, and you offer 4 different options for employees, but I used your point of service plan. An employee is paying, and there's actually a typo here, it should be $2,724 a year, is what they're paying out of pocket before they ever even see a doctor. That's what they contribute towards the premium for the city's plan. They then have an out-of-pocket exposure of $5,000, of which the city offsets that by $1,000 through a health reimbursement account currently. So the employee has a $4,000 out-of-pocket exposure in addition to the $2,724 that they pay. So if an employee has a bad year and they hit their out-of-pocket for the year, that employee is going to pay $6,724 out of their pocket. If they were under the Family Advantage Health Plan and they went on the spouse's plan, the average premium for private sector for plan would be $5,400 a year, more than what they pay here. But that's going to be offset by the $50 per member per month that you're going to give that family. So family of 4, you're going to give them $200 a month. That's $2,400 for the year, making their net premium cost $3,000. And then let's say the deductible's $5,000, $10,000, whatever that deductible is under the other employer's plan, that is going to be paid for by the city through that health reimbursement account. That brings the employee's net down to $3,000. That means for that particular employee, they are going to save $3,724 a year. Okay? I'm going to pause there to say, do you have questions on like the employee, how it works for the employee?
Yes.
Rebecca?
Okay.
Thank you. I just need a verification because you're moving very quickly.
Okay.
The $50 part
Per member per month.
per member per month.
Mm-hmm.
So that is,
Think of it as per belly button. So a
Yes.
family of 4, there's 4 belly buttons covered on the plan. They would get $200 a month, $50 per each belly button.
$200 a month. Okay, I'm getting confused where you say $50 per payroll, $50 or $200 per month, because there's typically 2 payrolls.
Yeah,
In a
it's
month.
just per month, not per payroll. So you will
Okay.
divide this out by however you process your payroll, but we just are talking about per month.
Per month.
So a family of 4 at $50 per belly button or per member
Yep.
would get $200 a month to offset the expense to take their spouse's plan.
And then the city opens up an HRA
Yep,
for that employee. Okay. All right, I'm ready to keep listening. Thank you.
okay?
Alderman Sevenick?
So those, thank you, Chair. So those funds go into an HRA and not to the person themselves?
The payroll bonus portion is paid to the employee on payroll as a bonus, and it is taxable to the employee. So for that family of 4, you're going to give them a $200 per month payroll bonus taxable to them that they can use for whatever they want. The idea of you giving it to them, though, is to offset any additional premium that they would have to pay on the spouse's plan.
Or, so you're saying taxable, so Medicare, Social Security, state, federal taxes are taken out of that
Yes.
amount? And is that considered?
Well, I think it's
We're
considered
looking at the bottom line?
well, if you're going to take taxes into account, you'd also take on the $5,400 example employee premium that they're paying on the spouse's plan. They can also take that premium pre-tax through the employer. So that $5,400 is really less than $5,400 that they net have to pay for that employer's premium, and then your $200 minus the taxes. So this example does not factor the taxes in, but there's taxes on both sides, on the payroll bonus, but also then that premium can be taken pre-tax through the spouse's plan.
So just let me ask you the tough question, why?
Why?
Yeah, why are we doing this? Why should we have to do this?
Well, if I can move forward a little bit, I'll
Sure.
tell you like why for the employer, okay? Like why should you consider doing this? Okay?
Sure, thank you.
All right. All right, so let me move forward. I'll finish up for the employee. So it's very simple for the employee. They get that payroll bonus on their paycheck. There's really nothing they have to do. Then how the employee can get reimbursed for expenses. There's a debit card that they can use at point of service. So if they're going to pick up a prescription, then there's a copay on that under the spouse's plan. They use the debit card. The debit card then, the charges goes to the city of Menasha, but the employee swipes the card and they don't have to pay anything for that prescription. If they have a medical expense because they've had surgery and it's over $1,000, they have to submit an EOB or the medical bill from the provider so that they can get reimbursed. So they have to justify the claims expense, and then that gets reimbursed. And that can be done in a number of ways. It can be done through a check, it can be done through a direct deposit. If an employee wants to mail in the paper forms, if they want to use the app, the website, there's lots of ways that employees can submit for that reimbursement, but the reimbursement then comes in either a direct deposit to their account, or they'll get a check in the mail for that reimbursement. Okay? So before I get to the employer, the other thing I want to cover is you'd say, why wouldn't every employee take this then? Why wouldn't every employee leave? And some reasons why they might not is the provider that the employee sees might be out of network under the spouse's plan. So let's say right now you have an employee that uses Theta Care doctors. Maybe the spouse's plan is an Aurora network plan and Theta Care is out of network. And they feel comfortable with their doctor and they don't want to change. So there could be a provider disruption. That might be a reason an employee wouldn't want it. Another reason might be the employer's plan may exclude a spouse. They may have an exclusion that says if your spouse is offered medical insurance through their employer, they can't be on our plan. There could be medical expenses that are excluded. So something that's covered under the city's plan might be an exclusion under that other employer's plan. That might be another reason that an employee might not choose to do this. They might be a low utilizer. So if you have an employee that's pretty healthy, that employee might say, I hardly ever use the insurance, so I would pay more in premium than I would pay being on the city's plan. So it really isn't worth it for me to make that change. Or it might just be that the other employer's premiums are just too high, that when you do the math based on the payroll bonus and the out-of-pocket expense, it doesn't make sense for the employee to do it. Okay, so why would employers love this? So the example that I'm going to go through here, if you want to forward one, thank you, two. Why you should do it?
No, yes.
Yeah.
Should we do it?
Okay, I think it's a savings. So what I'm going to get into, what's in it for the employer is the savings for you. So you pay on average, your total premium is about $28,000 for a family to be on the city's plan. Minus what the employees pay of just under $3,000, you net pay about $25,000 for every employee that takes family coverage under the city's medical plan. If the employee leaves your plan, on average, what you're going to pay in payroll bonus and claim reimbursement is going to result in a savings of $15,000 per employee. So there is a savings by getting that employee off of your plan. In particular, if we back up, about 80% of your claims are driven by 20% of your population. Okay, so 80% of your population is pretty healthy. The majority of the claims are coming from a small percentage of your population. Those claims, if those claims keep going up in the cost of those premiums and specialty medications and treatment for those employees, drive your overall renewal. Attorney Struve talked about a 24% renewal that you would have seen this year had you not had a rate cap in there. That is largely driven by your high-cost claimants. So if one of your high-cost claimants leaves the plan and goes on a spouse's plan, you are taking that high cost and that risk from the insurer away and putting it on another plan. And so in addition to the savings that you're going to see just between your premium and what you pay for that and what you're going to pay under the other plan, you are also going to see that in your renewals, because if the high-cost claimants leave your plan, your renewals are going to be less. Okay? So what this illustrates for you of how does that savings occur is we take your family premium right now, which is just under $28,000 for the year. You have to subtract out what you collect in employees towards the premium. That's the $27.24. On average, the out-of-pocket that you would reimburse for a member under the employer's plan would be just under $5,000. You subtract out the payroll bonus that you would give to a family of 4, and then you have an administrative cost, a shared savings cost, leaving your net employer savings of $15,800. So instead of paying $27,800, you're paying $15,800 every time you have someone leave your plan. That's why when you think about should you do it, I can't tell you whether you should do it. I can just present the plan to you as to say it really is about managing the spend for the medical. Because as Attorney Struve talked about, we know that aside from wages, the medical plan is one of the most expensive benefits that you offer to your employees. And so if you don't do something to manage that spend, even if your renewals are only 8% or 10% a year, can the city sustain an 8 or a 10% increase year after year after year on the medical plan? And what's nice about this plan, and what I really like about this plan, is it's not balancing it on the backs of employees. You aren't saying, well, our spend is going up, employees, so we need you to pay more, or we need to increase the amount of your deductible to pay more to help offset that. At a time when you're competing for talent and you're trying to attract and retain your employees, a way to do that is not to push some of those costs back on them. So you give them a raise every year, and then you turn around and take it out of their pocket by increasing what they pay for premium. This gives employees an option to save some money by going on to a different plan, so it saves them as well as the city. That's the logic behind the plan. We are not the only ones that offer this plan. Network Health Plan offers a version called the Family Savings Plan. Theirs operates a little bit different. Instead of the $50 flat payroll bonus, they actually reimburse the employees the difference between the other employer's premium and their premium, and they charge 35% in shared savings versus we charge 12%. So that's a pretty big difference in terms of what you're paying in shared savings for that plan. So we do have employers that are looking at this, and one of the other things you can do is you can do just a cash opt-out. Some employers offer employees cash to not take your plan, but that doesn't really incent your high-cost claimants to leave. Why this is attractive to someone who uses the plan is they don't have to worry about any out-of-pocket expenses. That's going to be covered by their health reimbursement account. Versus if you just give someone cash, you might have some of your healthy people leave. I'll take the cash because I don't use the plan. I'll go on my spouse's plan, I'll go on my parents' plan, and I'll take the cash. Some employers do an opt-out by tenure, so you offer an employee $5,000 if they've been here 20 years to leave your plan. And some employers do what's called a spousal surcharge. So instead of like giving employees an incentive to go on, you give them a disincentive and you charge them $200 more a month if their spouse has other insurance and they choose to be on the city's plan. So you kind of punish employees by making them pay more for the premium if they're going to take your plan. We see that those disincentives are usually not very attractive for public sector. I think public sector approves, in general, they kind of like the incentive approach more than the disincentive approach when it comes to managing the plan and the spend.
Okay, Sandy, I get a couple of questions from some of the aldermen. Alderman Rappella?
Thank you, Alderman Grady. Sandy, pharmacy, is there a limit on the amount of pharmacy charges that they could incur? Or
The max is the ACA limit, so I believe that's 18.2.
Oh,
So the most that you could pay for someone out of pocket, so the only time someone would have to spend more than that is if they go out of network. And so if they're getting their pharmacy charges and it's subject to deductible and not out of pocket, and they stay in network, they cannot exceed that amount. So the cap is the ACA limit, and for a family, that would be $18,200 plus the payroll bonus that you would pay.
so that would be for a family, $18,200?
Correct.
Okay. And then last thing, I know you're talking about penalizing the employees and different things like that. I was just thinking of Social Security, that's the same thing. Well, Social Security does that. They give people the cost of living increase, but then they go ahead and they raise the health insurance costs. So those guys, so if you're on Social Security, you really don't see the benefit as much because your health insurance keeps going up. So, and we don't want to do that. That's bad to do for the employees if we want to retain them.
That's correct.
Okay. All right, thank you.
Alderman Severnick?
Okay, well, thank you. Chair, educate me here.
Okay?
Help me with someone being on their parents' plan. Is it still age 27?
26.
26. Okay, that I've already forgotten. So what is classified as a family?
A family is an employee plus one. So if it's just an employee and a spouse, if the spouse has health insurance and the employee can go, or just the spouse goes. So if just the spouse leaves and goes on their plan, that family would get $50 a month, and you would reimburse only the spouse's out-of-pocket expenses.
So it's based on marriage.
It's based on, no, it could be children, so it could be an employee plus a child, it could be an employee plus a spouse. So if it's employee plus a child, if the child could go on the other parent's plan and leave the city's plan, you would also pay the $50 for that child to leave and go on that plan and reimburse their expenses.
Up to age 26.
Up to the age of 26.
Right. I'm saying, how about two people that have children that are not married? How does
Then,
that work?
are those two people on your plan?
Yes, that's what I'm saying. I mean, let's say there's an employee here
Yep.
that's not married, but they've been together for 30 years, and is that person able to go on the other's plan or vice versa?
If they can go on another individual's plan that can legally cover the other dependents, yes. So they don't have to be married. It can be the parent of the children. So mom and dad are not married. Dad works for the city. Mom works for one of the health systems, let's say, right? So the children leave the plan and go on mom's insurance. You would pay $50 per child to go on mom's insurance, and you would reimburse for any out-of-pocket expenses for the children.
Okay, how about if it's two individuals that have lived together for 30 years, no children? Is that considered a family?
No, but you also, that person can't be covered under your plan unless you approve, and I don't know off the top of my head, a domestic partner relationship where that person is covered under your plan. So it would be dependent upon whether that person is already covered under your plan.
That's where I needed to be educated, because I don't know what we do in that situation.
Most employers changed the domestic partners when they made it legal for domestic partners to marry. They made marriage the standard for reimbursement. Prior to them legally being able to marry, if you had domestic partners, some plans offered domestic partner coverage, some did not.
All right. You said get them off of your plan. Are other employees, other companies out there saying, hey, we're going to incentivize you not to take insurance here, go with that City of Menasha insurance?
You
We're
bet
gonna
they
give you
are.
money.
Private
So they're
sector's
doing
been doing that for years.
So basically, all we're doing today in this world is playing a chess game. There's something wrong here, something's broke. And I agree with the comment that was made earlier today from the public that, let's say this changes in 3-4 years. It just seems to me like a chess game. We're just trying to outmaneuver someone in the time being to save some dollars. And I would think that if I were an employer here, or employee here, and I knew that, say, my wife's plan was better, I would want to be on my wife's plan. I wouldn't want to be on the city's plan. Now you're saying, yeah, do that and we'll give you some money. I don't know. Something doesn't smell right. I don't like it. It just seems like we spend so much time all the time trying to figure out ways that we can get more money. I don't know. Maybe it's me, but this is probably a good idea and everything, but when I take a step back and I look at it in a different situation, something doesn't smell right.
Alderman Lewis.
Thank you, Chair. So I had a couple of questions. A few of them did get answered. I guess one of my biggest things is if the civic health care plan is as good as it is, why would we plan on a high-cost claimant leaving?
Because sometimes the spouse's plan, so a high-cost claimant, even though it's rich, your out-of-pocket exposure right now is $5,000 for family, of which the city offsets that by $1,000 through a health reimbursement account. So the employee's true exposure out-of-pocket, if they have a lot of medical claims, is $4,000. If they're to leave and go on the spouse's plan, they don't have to pay that $4,000 because the city is going to reimburse that for them under that spouse's plan. So even if the spouse's plan is a $10,000 deductible, that high-cost claimant knows that they're hitting their max out-of-pocket every year because they know based on their prescriptions or their medical treatment that they're going to hit that $4,000. So even if they hit $10,000 under the spouse's plan, because that's a deductible, they never have to worry about a bill because the city is going to reimburse the full $10,000 under that employer's plan.
Okay, and then just clarifying the discussion about the medications at the pharmacy. So you had said that that a person is only allowed to be charged, I forgot the number now,
18.2 for a family. Mm-hmm.
And they're not they're not allowed to be charged excess of that, but this plan would cover that full.
The full 18.2, if they hit the full 18.2. And the only time they could hit more than that would be if they go out of network. There is no limit if an employee doesn't stay within network and they choose to be outside of the negotiated network for the plan, then their expense is unlimited. Most employees do not do that. If it's an emergency and they find themselves out of network, that emergency is covered in network until they need to do follow-up care. Then the follow-up care needs to be at an in-network provider. So the only time an employee would find themselves where they owed something beyond that 18.2 would be if they went out of network.
Okay, but if you're staying within network, it will be covered, even
Correct.
if you have $700 medications every month?
Correct.
Okay. How would this, so I was a little bit confused about I get that if somebody already was declining our health care, that they wouldn't be included into this then, but what does that mean for new employees, like new hires?
New hires, you typically follow the same standard, but employers choose to do this in different ways. Typically, if you exclude employees, a new hire would have to be on your health plan for 12 months and then leave the plan in order to be eligible for this. So if you hired someone in February, they would not be eligible for that next year. They'd have to wait until the following year, and then they could jump on and take Family Advantage and get paid the reimbursement. But for the first 10 months and then that next year, they would have to be on the city's plan.
Okay. And I suppose this just wouldn't really have much of an effect on a singular employee that lives on their own.
Correct. A single employee, there would be no other employer-sponsored health plan that they could go to unless they happen to work another job that offered them health insurance. Or were under 26. So then they would have to be able to go on a parent's plan, but that parent's plan would have to be employer-sponsored group health plan. Can't be Medicare, TRICARE, anything like that. It has to be employer-sponsored health plan.
Gotcha, okay. Thank you.
Mayor, did you want to pipe in?
Sure. I just wanted to comment a little bit about Alderman Sednick said, because I felt kind of the same way. It seemed like a shell game when I first started looking into this, and it was a way for the city to save money. And then I started talking to some of the employees, and the employees I talked to didn't really talk about the saving the money. They talk about, I live paycheck to paycheck. And every month I budget X for health insurance, I budget X for food, X for my rent. And if all of a sudden my kid breaks his arm and I get a $5,000 bill, I don't know what to do. So I would rather pay an extra 20 bucks a month or whatever it is to go on this my spouse's plan and know that I'm never going to have to pay that unexpected bill versus a little bit cheaper health insurance through the city and have to worry that one month I'm going to all of a sudden have this big bill. So they looked at it as kind of a benefit that they would never get an unexpected bill. And we looked at it as a benefit that it would be less expensive for the city. But otherwise, I do kind of agree with Stan. It's kind of a shell game on the city side, but if it is looked at as a benefit on the employee side, well then why aren't we allowing the employees who think it's a benefit to take that benefit if it's not costing us more? So just wanted to throw that in too.
Alderman Rapella.
Thank you, Alderman Grady. Sandy, one thing, I'm due for a knee replacement. $75,000 is the charge.
Okay,
If I'm on the city plan, that the city's gonna pick it up, but now if I go on my spouse's plan, the city's still gonna pay this whole $75,000, correct?
no, because there's an out-of-pocket limit. So on the spouse's plan, that's what, under the Affordable Care Act, the most that an employee can pay for a family out-of-pocket is $18,200. So the most that you would pay under that other plan is $18,200.
So that's
So
the
if
most
you-
the city would pick up for if they're on that other plan.
Correct, you'd pick up the 18.2, well, it depends. 18.2 is the max that they can charge you, but most employers don't have their deductible or out-of-pocket set at 18.2. So let's say it's a $10,000 out-of-pocket max for your knee surgery. Once you pay the 10 as the employee, then the insurance pays the other 65,000, okay?
Okay.
So under this, the city's plan, that 65,000 would be paid by your medical plan, and of your share, you would pay $4,000 net out of pocket, but you also have to pay $2,700 a year to have the plan. You're going to pay $6,700 out of pocket.
Okay.
Under the other employer's plan, you're not going to pay anything. You're not going to pay that $4,000 out of pocket. You're going to pay nothing out of pocket. You're only going to pay whatever the difference is between that other employer's premium and what you're getting under Family Advantage, your $50 a month.
Okay, one more question. Who came up with the $200? Why isn't it just $100?
You mean 50 per person?
Yeah.
So what we find is 50 is normally adequate, but we do work with each municipality because depending upon how generous their plan is, sometimes we see that amount at $75 per member per month or $100 per member per month, because you want to have enough differential to incentivize the person to leave your plan and go on the other plan. $50 per member per month we find is generally adequate. So when I look back on the slides here, the difference for your employees based on that math in what we see in averages is they would still save $3,724. You could increase that amount to incentivize more people to leave. That would just reduce the amount of savings to the city.
Okay.
But you'd still save.
Okay.
Okay? Does that make sense? I know it's
Yeah.
like a lot. Nobody likes insurance, right? None of us care about what our insurance covers until we need to use it. Until we have a car accident, first thing we want to know is what our plan covers.
Okay, so we still could, so you said that there would still be that profit of $3,000 somewhere. So that was $50 a month. Could we lower it to nickel and dime this year? Could we lower it to $35 a month that we pay each person, and we would still have, there would still be a positive outflow?
You could. The question is whether employees at that rate would take the plan. So you're gonna reduce it from 50 to 35 for 4, so you're gonna give them 140 a month instead of 200. It's gonna reduce it by 60. Would the employees still take it? Most likely.
Okay.
Because I think, as the mayor says, the real issue for the employees are most employees can't afford a large unexpected medical expense.
We just gave them a pay raise.
It is the single biggest reason for bankruptcy in our nation is medical expenses. And so as the mayor said, a lot of employees do live paycheck to paycheck, and even if they are saving, they typically don't want to spend that on a medical expense. They have plans to buy a new vehicle, new furniture, go on a
Mexico or
vacation.
something, yes.
So that is really for employees, is even if I have to pay more a month to take that other plan, knowing I'll never be stuck with the big bill is more manageable for employees.
Okay, thank you very much.
Alderman Lewis.
Thank you, Chair. More of a general question for both our chair and,
This is going to take 3 hours.
sorry, it's kind of more of a general question, but will we get an opportunity to hear from our current employees, to like hear what their thoughts are about this? Because I feel like that would be helpful in actually deciding whether or not this is something to go through with, because, I mean, you can think one way or another, but if they're happy with it or if they're not, then I feel like that's an important thing to take into consideration when looking at a change like this.
That's a good question. So we had brought forth the cash in lieu option. Prior to doing that, the city had sent out a survey, so an insurance opt-out survey. One of those questions had been, if health insurance coverage were available to you through your spouse's employer, would you be willing to drop the city's plan if your medical and prescription out-of-pocket costs were reimbursed by the city? And out of the 82 total responses, 70 out of those 82 were currently enrolled in the city's plan. 48 out of those 82 had said yes, that the spouse was eligible for medical insurance from his or her employer. So yes, about 30 of those would be yes. So just to give you an idea, when the cash in lieu option was on the table, at least that's what the city had been pursuing last year. This specific question, though, didn't consider that specific cash in lieu option, just posed essentially if you had a different option available to you, and you were reimbursed by the city, would you pursue that other option? And 30 did say yes.
Not just a handful, but.
Okay, Alderman Eisnach.
Thank you, Chair. I want to say my husband has this plan through his, maybe not this specific one, but something very similar through his work. And being a business owner, I don't have insurance, so we can't opt out of his plan, but a lot of his coworkers do, and they love it. So I just want to throw that out there. Thank you.
Okay, we'll have one more question by Alderman Nichols. We're going to let Sandy continue. I think she's got like 10 more slides or something like that, but Alderman Nichols.
Okay. I'm thinking about what this would look like, and I'm imagining at least 3 buckets of people. The bucket of people who are simply not eligible because they're already in their spouse's insurance plan. Mm-hmm. There's the bucket of people that can switch, they're eligible. Mm-hmm. And then there's probably a bucket of folks who can't switch because of a policy that their spouse's employer has in place or because of some challenge with enrollment periods. Mm-hmm. So does anyone here tonight have an idea of what those buckets look like? How many people are in those buckets, and are there any buckets that I'm not anticipating?
So your single people wouldn't have an option, right? Because they don't have another employer or group sponsor plan to go on. So if a person is single, they don't have an option. Even if the other employer's plan has a spousal carve-out that says your spouse can't be on, the rest of the family could still go to that plan, just the employee would stay here. So the employee would take a single plan, the rest of the family could go then onto the spouse's plan. So the other bucket would be family where, as this older person commented, she doesn't have insurance. So if you're run your own business or you work for a small private employer, they maybe don't offer health insurance, so there is no other plan to go to for the family. There are some employees who maybe have TRICARE as an option, military, and that's not an option for them if they're on TRICARE or Medicare. So this is not something that would work for all employees. And we often kind of get the question like, well, that's not fair, right? I already waive because I'm on my spouse's plan. How come I don't get this? And I guess we work in the business of benefits, and so we see a lot of unfairness in benefits, right? So if the police chief here hires 2 officers on the same day, making the same rate of pay, one of them single and one of them has a family, you are investing quite a bit more in the officer with the family plan than the officer with the single plan, because the single plan costs a lot less than the family plan. So you could argue, well, that's not fair. I'm investing a lot more in the one officer that we hired versus the other officer, right? So there is going to be there's always with benefits some element what employees will say isn't fair. Okay, So I think you probably have, like, you could put those all in those 3 buckets, as you kind of have one, if you define it more broadly, as there is no other option, whether that be a single person or a family who has a spouse that doesn't work or their employer doesn't offer health insurance, and then you have those that would be eligible. And then you'll have some that it just doesn't make sense for them because the other employer's plan is too expensive.
Okay, and as an employee, I can certainly see the benefits of this plan. Is the proposal to leave the choice up to them, or are we forcing them to separate?
No, this is entirely up to the employee.
Okay.
So they can choose to, enroll in this option if they're eligible, or choose not to do anything at all.
Okay, and if folks who have not been on our insurance for whatever reason choose to come back for a year and then leave again so they can become eligible for this program, is that acceptable as proposed?
Yes, it is.
Thank you.
Is it a quick one?
Yes.
Oh, okay.
Thank you,
Alderman Propella.
Do we have, how many employees do we currently have that have opted out of our health insurance, Maggie?
We don't know that.
You don't know that?
I don't have that exact number. 10, thank you to Human Resources Manager Kimberly.
Got it. All right, that's fine. Thank you.
Okay, Sandy? continue.
Okay, so really the rest of my slides are really just to kind of go through what are the criteria. There's 2 main criteria. The employee has to be in your plan for 12 months prior to electing the Family Advantage Health Plan, and they have to have other group health insurance coverage. If the answer to either of those is no, they're not eligible for Family Advantage. Now, I will tell you, I do have a county client that they wanted to include the 10 that were already waiving. They included them in that offer as well, and offered them the very first time to take Family Advantage as well. And but it ate up some of their savings, but they wanted to do that from an equity standpoint, and so you can do that. It just goes to more of a sunk cost for you. Okay, so really all I have, and I really want to make sure that you all are comfortable, you understand what this is before you vote on it. So I'd say as long as you have questions, what I really just have the rest of the presentation is frequently asked questions. What if my family is already enrolled in another employer plan? We talked about that. It's the sunk cost. They're not eligible unless the city chose to waive the 12-month requirement. What happens if my spouse has a different open enrollment period than the other employer? This comes up a lot in school districts, and so it really depends on the employer and whether that employer will consider this offer that the city makes as a qualifying event for them to jump on the insurance outside of that enrollment period. If they do not, then they simply have to wait until the next election. So for the cities on a 1-1, if it's a school district employee and they've already selected what they want to do, they would have to wait until July 1. They would stay on the city's plan for 6 months, then opt off at the school district's open enrollment, and they would go on as of July 1st. So our first actually public sector client was the Winneconne School District, and they had a 7-1, and they had a number of employees that took this, and then they had more that took it in January because that's when the spouse's open enrollment period was, okay? What if my spouse's employer has a qualified high deductible health plan? Can I enroll? Yes, but you cannot either you or your spouse put any money into an HSA, and you cannot accept any HSA money from the employer for that, because you can't like double dip through the HSA. So you can still take the Family Advantage Health Plan, you can still have the qualified high deductible health plan, but you have to refuse any contributions to that plan. What if I enroll in Medicare? If you're on Medicare, you are not eligible for Family Advantage. We kind of talked about Medicare and TRICARE. Which employers does this program make sense for? Typically, it makes sense for most employers unless you have very low participation. So if you were an employer that your plan wasn't really that rich and a lot of people were already waiving, this probably wouldn't make a lot of sense for you because you have folks that are already waiving and have more generous insurance options. Is there a lot of added work for human resources? There is not. It really operates much like a flex spending account. Employees submit their medical expenses, they get reimbursed. We have a sister company, BCC, that does that administration. So the only load for the human resources team here is that initial setup. Otherwise, there's really nothing for human resources that they need to do. How's the administration fee calculated? You kind of saw on the slide about why employers would love this. It's calculated as taking your total premium minus what the employees pay, minus what you pay in reimbursements, minus what you pay in payroll bonus. That net amount is then the shared savings is calculated on that. So if you don't save anything, you don't pay anything. All right, so those are kind of the most frequently asked questions that we get. The other one that I get, because I mentioned the school district open enrollment office, sometimes employers feel like, well, we have a lot of folks that work for the county or the school district. We don't want to push them from one public sector entity to another. You can set up a qualification that if it is another public entity, they're not eligible for Family Advantage. Because I think otherwise, as the older person talked about before, the shell game, the idea of this was to push some of this back to private sector to even the playing field a little bit. On average, public sector has a dependent ratio of 2.71. What that means for every employee, they are bringing with them 1.7 dependents. In the public sector, that's about 1 to 1.1. So you have about 0.6 to 0.7 more bodies that are coming on your plan because of the more generous nature of your plan. And so what the Family Advantage is trying to do is not push it all back to private sector, but to level the playing field and push some of that back so that you're not carrying the burden of all those dependents. Okay? All right, that's a lot.
No, very good presentation and a lot of good questions too. So any other questions for Sandy?
All for universal health.
Well, I'll tell you, there's a lot of things wrong with our healthcare system and how prescription drugs are paid. And, you know, our job is really to just try and bring alternatives to the city to help manage that spend. And this is one of the ideas that feels better from an employee standpoint than making employees just pay more.
Okay. Thank you. We do have a staff recommendation if anyone wants to make this motion. If this does pass, then it would be offered to the employees. So until we approve it, we can't offer it. So Alderman Nichols.
Thank you. I have a question for Mayor Merkus. You mentioned that you spoke to several employees about this plan just to gauge their thoughts about it. Has anyone heard any possible negative feedback that we should consider?
The only negative comment I got back from one employee was they didn't think that their spouse's plan covered the doctor they currently have, but they were going to check into it again. But otherwise, they were positive about it. I don't know if Kimberly or Maggie had heard anything.
Generally, overall, a positive feedback in terms of this being an option for employees. Again, we're not forcing this on anyone, but simply an option that would be available for employees. But yes, generally positive feedback.
Thank you for that. And we have offered several health insurance options in the past. Is that still being considered for this year, or will those things change as well?
Once we receive the premium, the increase, we'll take another look at what we are currently offering, whether we can manage to continue to offer the same plans as, we currently are.
Okay. I'm going to yield to Alderman Sevenick, if that's all right with you, Chair?
Sure, as long as you're done. Okay. Alderman Sevenick.
Thank you, Chair. I think the staff recommendation is okay, but to me, there's a lot more that needs to be put into that. So This will be just a recommendation to the council, and I think we need to redraft that motion when it does get there. But at this juncture, I will make a motion to adopt the Family Advantage Health Plan as an alternative healthcare option for our employees, effectively starting around January 1st of 2024.
Second.
Okay, we do have a recommended motion by Alderman Sevenick and a second by Alderman Nichols. Any other questions or concerns? Let's take a roll call, clerk. I took forever to get it going. The mayor has to vote too, I think.
I voted yes, but it didn't vote for whatever reason.
If you're doing that, then I have a question.
Can we vote first or no?
No, you have to,
No.
I have a question.
Alderman Sevenick, is your light? I don't see your light. There it is. Oh, my thing's not working here, so if you can speak, just speak.
I just want to kind of go back to what the mayor said. It really puzzles me when he tells me, especially with all the work we have done to incentivize our employees, that they're living check to check.
I don't know
I
if
struggle with that,
I don't know
but
if
I
that's relevant to
feel
this.
that this should help in some way, but we do an excellent job of our pay, and not only that, but we just had the $30,000 study that told us that we're doing a good job, and we incentivize them even more. So I guess in a way that comment kind of scared me, and that's why I decided to make this recommendation.
And I guess that comment, whether you're making $500,000 a year or $30,000 a year, people tend to spend
Yep.
what they make. And most people, doesn't matter what they make, they still live paycheck to paycheck.
Good, glad you said it and I did it.
Okay, we can vote now? You're set, clerk? Nine zero.
Motion carries 9-0.
Okay. Thank you, Sandy.
All right.
Second item on our agenda is the memorandum of understanding by the Menasha Joint School District School Crossing Guard, the program. I don't know if this is the Chief Thorne to discuss. Start with him?
Yes, it
They do-
is.
Okay.
Good evening. So what you're looking at is a joint partnership between the police department and Menasha Joint School District. Currently under state statute 349.215, it provides the authority to appoint a crossing guard with a governing body by its ordinance. Our existing ordinance 10155 designates the police department as that entity to hire crossing guards. Historically, we've tried to be creative with how we're employing crossing guards, and we've had recruitment and retention issues, and really we need to make sure that we're covering all of our intersections, the intersections that have been established, to make sure that our children, our youth are getting to and from school safely. With this joint partnership, this MOU with the school district has agreed to take on 3 intersections, and the police department would maintain the intersection of Racine Street and 6th Street for crossing guard purposes. So really this is twofold, items 2 and 3. The third one, I believe, is an ordinance. We'd be looking at changing our ordinance to allow for Menasha Joint School District to employ crossing guards. Our understanding is that they would utilize current employees to fulfill those obligations. Additionally, the police department would be training their employees, providing equipment and uniforms, and ultimately the police department would then invoice the school district and they would pay us at that point. This is a fantastic opportunity for the police department, as, like I stated, we have had historical issues with employing crossing guards. Short-term vacancies have created inconsistent police coverage, with having to have an officer at some points come off the road, patrol coverage, to ensure that we do have crossing guard, our crossing guard positions maintained. Overall, there are benefits, long-term cost-saving benefits to the city that we would also be looking at. Thank you.
Okay, thank you. Does anybody have any questions for the chief? So, Alderman Rapella?
Thank you very much, Alderman Grady. Nick, I was reading this and I was a little confused about them stopping traffic with the red light and the different things like that. Don't they just walk out there? Doesn't take too much to walk out there with their sign saying stop. And what's all this writing here for? Let's see here. Option, stop paddle may be modified to improve conspicuity by incorporating white or red flashing lights on the side of the paddle. What is all of this stuff?
That's to provide the school district some guidance in terms of best practices. That information was actually pulled from the state website in terms of best practices for crossing guards. We would provide training on the actual components of how to be a crossing guard, what we would recommend to them.
Okay.
And you're right, I mean, at the end of the day, there isn't much to it. However, we want to make sure that it's being done properly.
Okay. And one more thing, I don't know who this, can I address this to? Are the crossing guards, this health insurance issue that we discussed just previously, is this, are crossing guards or bridge tenders, are they able to get in on this health insurance program?
So I can probably assist with that. So the actual crossing guards that are employed by Menasha Joint School District, they would be their employees.
Okay. Okay, got it. Thank you. All right, thanks.
Okay. Alderman Severnick?
Thank you, Chair. So are we looking to endorse or recommend to the council the memorandum of understanding?
I would think so, right? Yeah.
I'll move that we approve the memorandum of understanding for the Menasha Joint School District Crossing Guard Program along with the City of Menasha.
Second.
Okay, we do have a motion by Alderman Severnick and a second by Alderman Nichols. Any further discussion? We'll take a roll call vote, clerk.
Motion carries 9-0.
Okay. One more item on the agenda for this evening, and that's an ordinance 1223 introduced by Mayor Merkus. I don't know if Mayor wants to talk about this, or I don't know, Chief kind of talked about it a little bit, but.
This is just the ordinance that goes with the memorandum of understanding to allow it to happen.
Why don't you make the motion?
I can make the motion to recommend to the Common Council ordinance 1223.
Okay, we do have a motion by the mayor and a second by Alderman Nichols. Any other further discussion on this? All right. Clerk, can we have a roll call?
Motion carries 9-0.
Okay, with that, I'll entertain a motion to adjourn.
Second.
Alderman Nichols made the motion, and Alderman Grady, Tom, seconded. All those in favor? Any opposed? We are adjourned. Good evening. Thank you.